Hello and welcome to Health Watch Northumberland's monthly online presentation. My name is Tim Hakim and I am an Engagement and Insight Officer for Health Watch Northumberland. For those of you unfamiliar with what we do, Health Watch Northumberland is your independent health and social care champion. We hear from the people of Northumberland about their experiences of the health and social care services, and all feedback, whether good, bad, happy or sad, passed to those in charge of running services and who have the power to improve standards of care. This month's talk is from Jack Barber and Kirsty Elise and the Health Training Service about the support they and their colleagues can provide to the residents of Northumberland. One of the services we also do is help the people of Northumberland get information and find out about the sorts of support services in their local area, which is why we've invited Jack and Kirsty on today. So because we told us at the start of their presentation when we did the recording, we're going to run through the first couple of slides before we hand over to the presentation recording itself. So the Northumberland Health Training Service was introduced in 2004, 20 years ago. It's part of the Northumberland County Council Public Health Team. They support clients and communities to make positive lifestyle changes around weight management, health eating, increasing physical activity, reducing alcohol intake, and smoking cessation, and general well-being. Based on the original concept of support from next door with local communities, and they seek to empower individuals and communities to make positive lifestyle changes and embed those changes and healthy choices into their everyday life. They deliver a range of services within Northumberland, and it's all free of charge.
So for our service, you might be thinking, what is the eligibility criteria? So just to say that we are what you would class as a tier 1 service. So all that means is that we are one of the first referral pathways for people looking for some sort of healthy lifestyle support. So we have little to none eligibility criteria really when it comes to accessing the types of support we offer. In brief, all we ask is age 16 or over. So we are an adults only service, and that you must be living, working, or be registered with a GP in the Northumberland district. And that's pretty much it in terms of accessing our services and what we can offer you. So just to sort of summarize there, as you can see, we've got a whole slide of different things we can do with people or with groups. So that one-to-one support, so that could be done either through face-to-face support, or we do offer telephone support as well. We deliver what we call a way to go program. So this as well is more group focused, but can be done either face-to-face or online. We can deliver health focused sessions and health talks to a mixture of groups in various community settings. We can hold events or pop-up sessions, as we sometimes call them, which could be cooking programs, cooking demonstrations, healthy lifestyle programs. We also do mini health MOTs. So that would include your height, a weight check, your BMI calculated, and a blood pressure check to give you a bit of a basic health awareness screening. And that could be done again in any sort of community venue with a bit of private space. Something that we have recently started is the full NHS health check offer. I'm not going to cover that much at the moment because Kirsty will come on to that in a few slides' time. Being part of the public health department, so we do support a lot of the annual public health campaigns. So chances are you might have already seen us, or you will see us at a lot of community spaces as well, supporting these with stands and promo awareness stands that we will put on. We support health walks. So we do support walk leader training and just hosting and running walks as well across Northumberland. The 5 Ways to Wellbeing program, and then in general, we do just do a lot of internal signposting and promotion to other support services as well across Northumberland. So we try to stay closely linked with every other type of support service we can. So our Way to Go program, just to highlight this in specific, this is something that we did develop in-house. So this is our own program. So it's a 6-week healthy lifestyle program. So this is what we do to groups. So as you can see, across the 6 weeks, we have a different health focus, so that by the end of that 6-week period, you would leave that group, that session that you've been doing with 2 of the health trainers, just having a bit more of a more solid outlook on how you can have a healthier lifestyle overall. So you can see we'll cover a range of topics from the Eat Well Guide, fats and sugars, portion size, exercise, our triggers to a healthier lifestyle, and then we round up the whole 6 weeks with a little bit about alcohol awareness and how to maintain these healthier choices when eating outside of the home environment. So this, just to say again, that this is something that we do either online and face-to-face, and like anything that we offer, no charge involved. So we will always take people in that are interested in the work that we offer. And then just to highlight as well, some of the community programs that we do have a couple of photos just to show that we have done various cooking programs, cooking on a budget programs. So these are things that we take groups through to show that how they can make healthier meals, sticking to the Eat Well guide, and that's our forefront focus when it comes to our nutritional guidance, but how they can make those types of meals without having to break the bank and spending too much money. So we take groups through that, which is really helpful, and we do have quite a bit of interest with our cooking groups that we run. And then also our walking groups, which we have set up and ran quite a lot of walks across the county in recent years. And something that does good come out of that is that we do, as I said earlier, we do link with walk leader training. So at the end, sometimes health trainers might be able to step back away from those community walks, and it lets the community run their own walking groups, which is great when that does happen, and that has happened as well in the past. So I'll pass you along to Kirsty now, who's going to take you through the rest of our presentation.
Perfect. So can I just check you can hear me, yeah?
Yeah.
Yeah.
Okay. Just wanted to check before I start talking. So as Jack said, one of the newer kind of things we've started delivering is the NHS health checks. So we've now started delivering these in community and workplace venues across Northumberland, okay? Now, the NHS health check is a free checkup for adults aged 40 to 74 without any pre-existing health conditions. So basically, making sure you don't, so you'd only be eligible if you don't have kind of high blood pressure or already have diabetes or heart problems, that kind of thing. So it's just for people who don't have any of those conditions. And it's basically to help identify if you're at a higher risk of developing those, so we can try and catch them early and think about kind of reducing those risks going forward. So with the health checks, it is the check that you would previously get at your GP. So you still can get it at your GP, but our target is to get it come to you. So that's the thing. So if we're targeting those community and workplace venues, make that access a bit easier to those services. So the health check includes, it's a kind of overall proper good kind of MOT health check. So it's looking at things like your height and weight, and then calculating that BMI. We also look at the waist circumference, because it's not just about kind of that overall weight. Where we store that weight is also important in terms of that kind of risk of kind of future health conditions. We have kind of blood pressure checks as well. What we also do is a little finger prick blood test, okay? And that is to check for cholesterol, and for those eligible, we also check blood sugars, which is looking at risk of diabetes as well, and a few lifestyle questionnaires thinking about our activity levels, our alcohol intake, smoking intake, and our risk again of that developing type 2 diabetes. So with the health checks, what we're aiming to do in the community is lots of pop-up events, okay? So it would just be drop-in pop-up events for those going forward, for that there. Fab. The next one. Perfect. So as Jack said as well, one of our kind of big offers that we have is our one-to-one health trainer clinics. So this is that one-to-one support with one of our health trainers. It can be a little bit more kind of focused on you and going from there. So what tends to be is 30-minute appointments with one of our health trainers around that healthy lifestyle side of things. So setting goals, whether that be around weight or eating a bit healthier or becoming more active, thinking about ways in which we can kind of help you to increase or improve that healthy lifestyle side of things. So again, these are face-to-face or over the phone. We've got a few telephone clinics during the week, and we also have an evening telephone clinic for maybe those who are working in the day and can't access those kind of 9-to-5 sessions. But that there just shows an example of the list of the places that we are for the face-to-face ones. So we do try and really cover the entire county. So we are kind of based in the north, out in the west, but also in that kind of southeast region as well for that one-to-one support. Come on. Fab. So this is just a bit of a a case study that we had for one of our clients. This was a good few years ago, but he's obviously been happy for us to use his information here. So basically the story with this client is he went to the GP and felt he needed kind of support around that weight loss side of things as he was really struggling on his own. He got referred to us. He went through that one-to-one process with us, and obviously not a short story, but long story short, we saw an absolutely massive improvement in the weight, which we can see here. So through that one-to-one support, using things like food diaries, talking about how we can kind of look into that Eat Well guide, have that balanced diet, increase activity, things like that. But one of the biggest takeaways from this client story is it's not just about that weight side of things. So a big part about our services, it's not just that weight management service. Yes, it was a benefit, but he also saw lots of other improvements. His blood pressure came down, his overall well-being was better. He was able to kind of go out, socialize that a little bit more. He felt better in himself, all these sorts of things that came from that, coming to our appointments and seeing that. So yes, weight may be that most obvious thing that he saw from it, but it is that cascade of other benefits that he got from that there. And you can see from those photos, it is a big change. So he went, I can't actually see from where I am, but he went from kind of 149 kilos to around 95. So a big drop in that, which, as I said, caused those other really, really positive lifestyle benefits as well for him. Fab. So we do need to update this at some point, but so at the minute there's 4 senior health trainers. So our role in the service is more this kind of thing. So our role is to do the kind of networking, coordinating, make those links and organise that kind of health trainer work. We've then now got 9 health trainers. So in the last couple of months, we've had 5 new health trainers join. So we're in the process of getting that all up and running. So we'll have even more capacity to do more work and cover more of the county, and hopefully just get even more done. So there's our 4 that we've pre-existing health trainers, and we will have 5 more photos soon to update this on as well. Fab. So how to actually refer to us. So obviously it's all well and good knowing who we are, but if you can't actually get to us, that's obviously a big thing there. So we do have a referral form. This is now actually Microsoft Forms. So we've recently just changed this. What we will do is we'll try and, if we can try and get that forms link sent out with this, but it also will be updated soon on our website. And for kind of main referrers, we're trying to get to them to let them know. So all that would be is for healthcare professionals or for self-referrals, complete that Microsoft form and that comes straight to us. Or you can refer over the phone. So it would just be giving us a call on the number shown there and we can get people referred in from there. For other professionals who have access to ICE, you can also refer through that. And I've just realised that we've got a QR code for that new referral form. So if anyone gets access to these slides after or just now wants to take a quick scan of that, you'll be able to then access that referral form. It's nice and easy, the referral process. As I said, either fill the form out or give us a call. What we'll do is we'll be able to kind of chat to you, or if it's a client that you've referred in, and see which offer they prefer best. So we can kind of do that triage side of things, see if they prefer the group support, that one-to-one support, and then give them the information they need going from there. We also do have a website, so you can see there, Living Well Northumberland. It's got lots of information about our service, but what it also does is it has lots of information around the healthy lifestyle topics that we cover. So it's got information around a healthy diet, trying to increase physical activity, reducing alcohol intake, all those topics that we cover. We've got information on that website, which includes things like healthy recipes and things like that as well. So it's definitely worth having a look on there. And that's also got the information of how to kind of refer to us and things like that as well. Fab. So that is us there. It's a nice quick presentation for everybody, but if anyone has any questions now, Jack and I would be happy to cover that. And Jack, I don't know if you've got anything else to say that I might have missed off there.
No, nothing. I'd just maybe add on about the website that we do have an inquiry form as well. So if anything comes to mind, that goes straight to our health trainer admin inbox. So any questions that'll get answered in our emails as well.
Okay, thank you for that. That was a clear and concise presentation. Excellent, thank you. I've got a question about the health walks you mentioned. What sort of distance do you cover or time spent walking?
So they tend to be nice and easy. It will depend on the different walks, but we try and make it as accessible as possible. So they will be kind of short distance going at a slow pace. So it may be you're even out for just a kind of 20-minute walk or so. Again, it depends on which one, but around that maybe 20-minute mark, we tend to walk from somewhere to another place or in a loop and end up and be able to have kind of a bit of a tea and coffee and a chat. So it's around that social element as well as the walking, but they're kind of that entry level walk. They're not too intense. We're not taking anyone on a hike, just a nice, simple, accessible walk.
Great, thank you. And in answer to Bethany's question, yes, we're going to send out the link to the recording afterwards once we upload it to our YouTube channel. And then Tracy had asked a question, are there no face-to-face sessions in Alnwick and surrounding area now?
So I'll chip in there. So yeah, so we did used to run a face-to-face clinic in the Alnwick space, but naturally sometimes our service is just quieting down a little bit, and obviously where there's no need at the time, we do sort of pull away from certain areas, and especially when there's other professionals doing similar things. But we are very keen to still get that offer up in the north, and we have got a couple of things in the works, but nothing official as of yet. So we're not neglecting that area. We are still targeting certain spaces. So it's just a case of once something is set up, we'll be sharing that on the websites through email networks that we've got something up and running one-to-one anyways.
There's another question here. That's okay, Jason, no problem. How often do you see your clients during the 6 weeks program? Is it once weekly or does it vary depending on the individual's needs? And also, the second part of the question, what happens after they finish the 6 week program and need further support?
So the 6 weeks program, so with the way to go, well, I suppose really with any of our programs, they usually all tend to be around that 6 week-ish mark. It is usually weekly, so it's usually the same date and time every week, so it's a consistent commitment, so we're not going to chop and change, because obviously it's a bit of a commitment to sign up for an hour or so for a 6 week block. After the period's over, if they needed more support, they can still access other services that we provide. So if, say, they came to the group and they needed a bit more, they could access the one-to-one. Or, as I mentioned, we do a lot of onward referrals as well, and just general signposting. We can talk through the other options in the areas as well, which is dependent on where we do the work.
Excellent, thank you. And then the question here from looks like a keen volunteer. Are you looking for walk leaders, stroke helpers?
We are always looking for walk leaders. So it's our colleague Amy who does the walk leader training, and she's always looking for extra people to kind of train up and get out and about, because a lot of them we can help kind of start in the walks, but a lot of the time if we are able to take a step back and have other people continue, we can help set them up in more and more areas. So yes, definitely. If you kind of either go on the website and pop in kind of your information there, or if you send an email over to the health trainer inbox, so that would just be healthtrainers@northumberland.gov.uk, and we can send your information on to Amy and she can contact you about that, if that is something you'd be interested in. But yes, anyone who wants to be a walk leader, we're always looking for new people.
Is there much training involved or is it quite straightforward?
It's not too bad, so it tends to be, there's a little bit of pre-work before the session, so I think that would maybe take, I don't know, maybe no more than an hour, a little bit more than that maybe, and then it's about a 2-hour session in person with Amy, and that would be talking about how you kind of prepare for them, the risk assessment side of things, and that includes going for a walk and doing a risk assessment with Amy, and if there's a group of you doing it together, just to get you prepared for if you do go out and start your own walks.
Great, thank you.
And that is free as well, that training, just on that.
Any other questions for anyone? Well, I think Thomas rounds up our presentation for this month. Thank you very much, Jack, and thank you very much, Kirsty, presentation. Likewise, we'll be sending out slides to everyone after this session is finished, and we'll send out a link as well to recording when we've got it up on YouTube. So thank you once again, and have a good afternoon, everyone. Bye.
Thank you. Bye.